Hello, I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. Last episode, I interviewed tennis icon Martina Navratilova about her breast cancer journey. In today's show, I continue to recognize October as Breast Cancer Awareness Month as I speak with acclaimed actress, producer, author, and activist Sheetal Sheth about her experience with breast cancer and what inspired her to write a children's book called Making Happy. October also raises awareness for mental health, so I'll talk about how both conditions, cancer and mental illness, are connected. Let's get started. Well, greetings, my friend Sheetal. How are you?
I'm well. It's so nice to see you. Happy Diwali. It's Diwali season. So for anyone who celebrates, happy Diwali.
Thank you. Exactly. Happy Diwali, everyone. And to you as well. Sheetal, it's so good to see you again. We met by Zoom before. I did an interview with you for Forbes. I think it's been probably 1 or 2 years ago at least, right?
It's been a while, yes.
Definitely before the pandemic. And you were talking about your breast cancer experience at the time. And then we actually met in person, but maybe
Yes.
1 or 2 months ago recently.
Yeah. Finally, like it feels like we're meeting people again.
And doesn't that feel great to have that in-person connection again, safely?
I missed it. I mean, you miss it, but then as we're all kind of going back into the world, I think in our own ways, little by little, you need it. You need the human connection. You need to see each other. You need to feel each other. You need to get the, all the things that come with that is something that I don't think any of us will take for granted ever again.
1000%. And they even say, like, even for the shyest people in the world, even they need connection, right?
Mm-hmm.
So we as human beings just really need that. So yeah. I am so grateful to you, my friend, again for meeting with me and doing this conversation, having this interview. You have such a compelling story. We're going to get to your book, but your journey has been so phenomenal and fascinating. You are this amazing actress and artist. Writer, and what I would love for our viewers to know about you, to the extent that you feel comfortable, can you share your breast cancer journey as a South Asian woman, actress, mother, wife, living in the United States?
Yes, and thank you for that. Yeah, I was diagnosed with breast cancer on Christmas Eve of 2018. I remember it very clearly because those words. No one ever wants to hear those words. You have cancer. And, I'm young. And so this is not a disease as common as it is that necessarily affects as many young people. And my kids were really young. They were babies. They were 2 and 4. And what I realized through, there were many facets of kind of what happens when you get diagnosed with cancer. And there's like the medical piece of it. How are you going to treat it? Are you going to survive? All of the treatment, and then how to navigate yourself through the hospital system, in my opinion, the healthcare industry needs a lot of work. I mean, it's a mess, and I saw it firsthand. And so, but I think when you are South Asian, and I am from India, there is an added, there's a lot of things we don't talk about. And health and sickness particularly, and mental health is something that is very taboo in the South Asian culture. And I want that to change. And I hope that, and it is changing little by little. But so when I decided to come and share my story, it was very much in that space of like, why don't we talk about this? This is crazy. It affects so many of us. And the fact that we don't have shared community around something that we all deal with, really perplexed me. And there were so many things that I was dealing with on my own, and that added layer, that community piece of it, was something I really needed. And I've always been someone who loves community. So to not be able to kind of share it in that vein didn't feel right to me. And so, but I learned a lot, and it was interesting to kind of see how it all found its, like, when I talk about like the layers of cancer, being Indian is a piece of it that I think is different, and if you're Indian, you get it, or you don't,
Well, so much of what you said resonates with me, even though I'm not in the same industry or field as you, as an Indian woman in the healthcare system, who has treated many patients with chronic terminal illnesses, certainly cancer, but many, many other conditions. And somebody who comes from a community, an ethnic community, where certain things are not discussed, certain diseases are stigmatized, they're taboo, you don't talk about it. We were just talking earlier about how, the chronic conditions in my own family, my mother and father, and my mother carrying the burden. We don't talk about these things. I think you briefly touched on mental health. There are certain things, conditions that are even more taboo and stigmatized. And the sense of connection and community, both as in when we know how much family is it's so important to our community, talking, connecting. But if you don't communicate and share your deepest worries and struggles, then that's going to have an adverse impact on health, right?
100%. And it's also like, I joked, because when I was diagnosed and going through it, I joked with my husband. I go, if I lived in India and I was part of, being born and brought up there, and I was destined to have a match marriage where, you are introduced to people, me having cancer would be a mark on my biodata, because those are things they ask. Is there any serious illness in your family? Is there any serious with you? And because it's looked upon as a negative, and that you did something wrong, and that we did something to have brought that upon ourselves, and now our bloodline isn't as pure as it could be. You know this, and so it's
crazy to think that, right?
Yes.
Yeah, and when you say a mark, like an X, it's a bad thing, right? Like it's a sign of weakness. Oh, what did Sheetal do wrong to get?
Poor girl, she's such a lovely girl, but she's got cancer. She's unmarriable. Done.
I'm sorry. I'm not laughing at you. I'm just laughing at the ridiculousness of the system.
Yes.
Well, thank you for sharing that. There's so many aspects that you talked about, including how, as a doctor, I know that the healthcare system that we have, it's far from perfect. I've been a patient and a doctor navigating the system, far from perfect. So that's why I think telling these stories really makes an impact, because if you went through, then imagine all the others. And I know that kind of leads me to my next question, which was this experience, specifically what aspect of your cancer experience inspired you to write your children's book?
For me, when I got diagnosed, and because I love books, and I think that art in general and books are a great pathway to change minds and open hearts. And I think they're great conversation starters, great icebreakers, great for everything. And that's why I give books to everybody for gifts. And so when I wanted to talk to my kids about what we were about to go through, what we were going through, I was looking for a children's book that dealt with illness or death and grief and all of the things when you're going through a hard time that you deal with. I couldn't find any. And I reached out to my publisher friends and my friends who worked in the industry, because I had written other books, and I said, where are the books? Do you have anything you can recommend to me? And I was met with a resounding, oh, no, we don't talk about that. I'm like, you don't talk about mental health? And they're like, it's too much. It's depressing. It's too much for kids.
It's too heavy for kids, right? It's too heavy
for kids. And I said, wait a second, because our kids are doing lockdown drills. They're being shot in their schools. So I could go on and on about everything our kids have to deal with, but we can't talk to them about illness and mental health and grief and how to process. I go, we expect our kids to be resilient and to cope, and we don't teach them how. And that is what really drove me to then write the book that I wish I had for my kids. And my book is it's called Making Happy, and it's a children's book all about giving kids permission to feel whatever they feel. And I found that, this, when you see a kid, I always like to tell this story, when you see a kid having what some people may call a tantrum. I don't like that word, but that's what people may say, they're acting out.
Yeah.
The reaction of the adults around them is always to get them to stop. And I get it. Like, you want them to stop with the crying, stop with the screaming, stop with whatever it is. It's overwhelming, and you just want it to stop. But we're not getting to the core of it. So we're always telling our kids to stop crying. We're always trying to tell our kids to stop feeling whatever they're feeling. So inadvertently, we're teaching them to repress their feelings, and that you can just wish your feelings away.
Right. And all of that, and that their feelings are bad or negative. That's why they should stop it.
Correct. Exactly. And so, and we see what happens. We see all of these adults not being able to process their feelings
Yeah.
and what happens with that. And so for me, I always remember what my kids' preschool teachers say to me, and it's easier said than done, I know, because I've had my moments too, but they say, just remember your kids are not giving you a hard time, they are having a hard time. And so if you enter it with that in mind, it's different, right? So it's really, for me, it's like, okay, you're having these feelings. It's fine. It's okay to be angry. It's okay to be sad. It's okay to be terrified. It's okay to want to like hit something, but let me show you how to get through that. And what's the healthy way through that? And so it's really, we can't stop these feelings and conversations. We're teaching how to get through it. And the only way to get the other side, as we both know, is through it. And so this book is really is about a family who's going through a hard time. Obviously, it's very personal to my experience. And it just talks about like this little girl who doesn't feel like doing anything. And she's having all these feelings that she doesn't understand. But how do you find those pockets of happiness as a family to get through a hard time?
Well, you said so many things that really struck me. I loved what that preschool teacher said. Your child isn't giving you a hard time; they're going through a hard time.
Yeah.
In
Yeah.
in my field, we're also trying to reframe how we ask. Talk to patients who've experienced pain and stressors and loss and tragedy, and instead of asking, what's wrong with you, asking what happened to you.
Yes.
As adults, we have difficulty processing and communicating. So can you only imagine
Of
children?
course.
And then dealing with something complex, as your own mother or father's illness, right?
Yeah. Yeah. It's scary. It's scary for them. I mean, it's just, look, we turn on the news and I've actually just read a report the other day about how the news, the anxiety it creates in people, right? Because of what's out there, obviously the clickbait and the sensationalism and the whole, like, you'll stop and watch an accident, but you won't stop and watch the good thing that's happening, right? And so we're constantly being fed images and stories that are really distressing. And so our kids pick up on that. Our kids see it. The news are on. And yes, yet again, we're not talking about it with them. We're not helping them through this world. And it is our job to teach them how to have that. I mean, I wish in schools, along with PE, there was mental health education, and teaching kids that your mental health is as important as your physical health. And let's teach you how. Like, that would, to me, would be amazing.
Well, so perfect segue into my last question, which was, as Sheetal, October is Breast Cancer Awareness Month, but it's also mental health awareness, and this is a topic that we don't really talk about anywhere near enough. So my question was, how do you feel? And we just talk about cancer in general, cancer and mental health. How are these topics related? Because for many people, they may not be as intuitive.
Well, I'll tell you, for me, and I feel like it's common with a lot of people in my breast cancer community, the survivorship and the mental piece of it is very difficult. I mean, not to say that the kind of going through the treatment isn't hard, but to then live with the fact that you've had cancer and that it can come back at any time, that survivorship, and I hate not to use a cross word, but it's the only way to say it, the mind fuck of it all is very, very difficult.
Yeah.
And so I think it's hand in hand and trying to find peace in our experience. And how do you move forward now with that being part of your experience is something that I think we're all dealing with, and it's evolving every day.
And tell me if you also agree. A couple of weeks ago, I interviewed Martina Navratilova, the tennis legend. She also had breast cancer, and what she was voicing to me, and many of my own patients have said the same. Just the whole process is anxiety inducing, right? Waiting for the test result, waiting for the next mammogram, waiting for this blood result, waiting, like just the waiting, and then processing those emotions. Okay, how am I going to communicate this? How am I going to tell my people at work? How am I going to afford this? Every step of it
so
is extremely stressful, right?
Oh my God. And what's so interesting that you bring that up is that when I was diagnosed, like it came, like I felt like what felt like a pebble in my breast one morning just after out of the shower. And I was like, oh, I needed to get my mammogram anyway that year. Did not think I thought it was because I was breastfeeding my kid, all the normal things, not thinking anything serious. I made an appointment at 7:30 in the morning because I had to go to my kid's school after. And I was like, I'll be in and out. And sure enough, it's taking longer than ever. And they're like, no, we need you to stay. And I'm like, why? And they're like, we just need you to stay. And then I could tell it became more serious. No, we need you to do a biopsy today. And I was like, well, what do you mean today? I can't do it today. So they're like, well, I'm like, I have to go. And they're like, okay, go, but you need to come back. And I remember coming back and I had to go to my kid's school, and I called my husband and I was like, I have to go get this biopsy, not realizing he was like, do you want me to come? And I'm like, no, I didn't even understand what was happening. And I remember going to get my biopsy and being changed into like this robe that they put you in. And then I walked into a waiting room, and that waiting room was packed of women of all ages, all wearing robes. Yeah. And that's where it hit. Like, I sat down and I looked around and I was like, oh my God, like, yeah, I might have cancer. Like, that's the first time. And I was like, I really wish I wasn't alone. And it hits you at different points of it, because it is there's so much going on, but again, you're going through it. You're trying to kind of just keep it moving. But when you sit and actually like think about it, it's really scary.
It's scary. There's actually very good data showing that there's a strong correlation connection between various types of chronic illnesses, particularly cancer, with various mental health issues, depression, anxiety, PTSD, and all the things that are associated with grief, lots of complex emotions. So it's not at all uncommon. The thing is that most people just don't make the connection, and they're not openly talking about it like you are. Honestly, Sheetal, just talking about it, sharing your story, you are truly making a difference. And to the viewers out there watching, I've had the honor of reading Sheetal's book. She gifted to me. It's just a delightful, beautiful book. It's such a sweet story. I encourage everybody to read it, get it, buy it, give it as gifts. It's just such a sweet, sweet story. Sheetal, is there anything else that you'd like to say and add that I haven't asked?
No, this was so nice to talk to you. Yeah, and just about the book. The book is really for a family that, it allows families to talk about feelings and big feelings. And what does that mean to you? And I think there's no better place than to sit in someone you love's lap to have that conversation, because I think the best thing we can do for our kids is to equip them for the world they're going into.
1000%. You articulated that so well. I'm so happy for you that you're happy and healthy now, and your family, and you are giving such a gift to the world, Sheetal. Thank you so much.
Thank you for having me. So good to see you.
You as well. I am so grateful to Sheetal for her bravery in battling cancer and for sharing her story with all of us. Her book, Making Happy, is a sweet and loving story for kids who are experiencing a difficult time trying to figure out how to process their emotions. It's great for the whole family. I really loved it, and I think you will too. The connection between cancer and mental illness is well known. According to the Mental Health Foundation, people who experience cancer are at increased risk for developing mental health problems such as depression and anxiety. In addition, 70% of young people experience depression during their cancer treatment. So, if you or a loved one is experiencing a hard time, just not feeling right, please get help. Talk to a doctor, talk to a counselor, get screened, get tested. You deserve it. So how can you get involved? Learn more about breast cancer and mental illness by donating to or volunteering with trusted sources like the CDC, the American Cancer Foundation, the South Asian Health Initiative at Memorial Sloan Kettering Cancer Center, the Center for Addiction and Mental Health, the National Institutes of Mental Health, and the South Asian Public Health Association, and many others. Well, that's all for today. And here's your joke of the day. Why should you never write with a broken pencil? Because it's pointless. Be sure to subscribe to my YouTube channel, write comments below, and follow me on Instagram at Health, Humor, Harmony, Dr. Roy. Be well. I'll see you soon.